Everyone, I'm Dr. Anabel Rodriguez, and today I am with Dr. Brett Perkison, who is a board-certified family medicine physician, as well as an occupational environmental medicine physician and an assistant professor in occupational medicine at the University of Texas Health Science Center at Houston School of Public Health. Thank you for being here with us today.
Yeah, delighted to be here, Dr. Rodriguez. Thank you for inviting me.
Of course. So Dr. Perkison is going to answer several frequently asked questions about the COVID vaccine. So let's get started. So this project was supported by a grant from the United States Department of Agriculture. We're going to divide this talk into three parts. So the first part is basic information about the vaccine. So Dr. Perkison, how were coronavirus or the COVID vaccines developed in such a short time?
Yeah, so that's a good question. So we've actually been studying, science has been studying coronavirus for the last 20 years. They've been working on vaccines for other types of viruses. And so all that information was ready to go when we had this first outbreak back in January of last year. And really what we've been working on during this last year is taking that technology and what we've known about the viruses and making sure that the vaccine's safe, protects people and is safe before we release that. And so there were a number of different studies that went on. And so that at that point, we were ready to release the virus treatment plan with these vaccines in under a year. And so that's how we were able to successfully do that to create this really effective vaccine.
Great, thanks for sharing. So our next question is, how do the COVID-19 vaccines work?
So you can really think of the vaccines as two different ways. The first was with the Pfizer and Moderna vaccine, which we've heard the most about. And researchers were able to look at the virus and how it attaches to cells and actually able to make a vaccine that blocks the virus from being able to enter the cells. The Johnson & Johnson vaccine, which has come out more recently, it works more in teaching the immune cells to recognize this virus. And so you have a protein that teaches these immune cells, and so that when they see the real virus, they're immediately able to react. And so both of these are very effective ways of creating a vaccine. And you can see here in this diagram that there's two different ways that they're administered. With the Pfizer vaccine, you get your first one, and then it's 3 weeks for the next one. And that's really to boost the immune system. So the first one's effective, and then the second one is boosting the immune system even longer so you can have continued protection. And then like that, Moderna, when the researchers did these trials I was mentioning, they found that spacing that one out a little bit more to 28 days made that as effective, 95% effective against the vaccine. And then with the Johnson & Johnson, with this new technique, you achieve these higher effective rates with just one dose.
Great. Do the COVID vaccines have a microchip?
And no, absolutely not. That is not a technology that exists, and so that is not possible.
Thank you for clarifying that. So, Dr. Perkison, are the COVID vaccines safe? Is it safe for me to get a vaccine if I have an underlying medical condition such as diabetes type 2, type 1, heart problems, kidney disease, among other medical chronic conditions?
Yes. As I mentioned during this last year, these vaccines were produced early on. They were tested in a variety of people, in a lot of people in these trials, and they've been found to be very safe. We have administered, as of today, about 80 million vaccines in the United States alone, and almost over 270 vaccines worldwide. And right now we've found that fewer than 5 people for every 1 million vaccinations have a severe adverse reaction. And that these patients, when they do have any reaction, they fully recovered. And so if you looked at the risks versus the benefits, there is a lot of benefit to going ahead and getting this vaccine. We're not seeing any of the complications that you would with COVID-19 because this is not a COVID vaccine 19 reaction, simply a reaction to the vaccine.
So if I've already had COVID-19 and I recovered fully, do I still need to get vaccinated with the COVID vaccine?
Yes, we're going ahead and recommending that. It's important, it's available. You are even more protected than you would be having just had the virus by getting this vaccine. There's no indication not to.
Awesome. So we're now moving into part 2, which is how to get the vaccine. So one of the questions, or some questions that have come up, is when will it be my turn to get the COVID vaccine? And where do I sign up to get the COVID vaccine? As well as how much do I have to pay to receive the COVID-19 vaccine?
Yeah, so that's a good question. So for those of you, that are following it, the first group of people that we wanted to give this vaccine was what we call 1A, and that's the healthcare workers. That's so the healthcare workers can continue to treat people with the COVID-19 virus. And so that is well underway. Most healthcare workers have had the opportunity to get a vaccine. The next group, 1B, is those people that we have found that are at risk for more severe COVID-19 infections. And that is people that are older and people with chronic diseases like lung diseases, like COPD, or heart diseases, people that have had heart attacks and strokes. So they're an indication. Of course, people that have had cancer or under cancer treatment. We're beginning to enter the phase now for phase 1C for essential workers. And essential workers is really a wide variety of people that it's critical for us to keep us going as a society. And that includes teachers, it includes grocery store workers. So you very well could be deemed an essential worker. We're also being able to distribute this a lot more widely. We have a lot of pharmacies, CVS and Walgreens, a lot of grocery store chains that like HEB that are beginning to distribute these vaccines. I also, an easy side is to go to your county website. If you type in the name of your county and say public health, so Harris County Public Health, for instance, and type in COVID-19, if you search that, most counties will have a link for you to sign up to be able to get your vaccination. If you are a member of a healthcare system, any healthcare system or clinic, I would also suggest checking in with them because usually they are tapped into a way of getting a vaccine. I would not be hesitant to sign up for more than one of these methods to get the vaccine. Nor would I wait until you feel like you're in the right group. It's good to get your name on the list. Oftentimes, if there's a surplus of vaccine for a given day, they're able to move to different groups, to the 1B or 1C group, and you very well might get a call and get an opportunity. And the federal government purchased these vaccines for you to use, 300 million vaccines. The goal is to have a vaccine available for everyone in this country. And so you should not expect a charge for the vaccine. You should not expect to be asked for your credit card. This should be free to you, or it should be billed to your insurance if you have it. If you do not have health insurance, you should not expect to pay for it. This is something that the U.S. government has provided for. And so I would encourage everyone to go ahead and sign up.
Great. This was very insightful. Thank you. Next question is the COVID-19 vaccine available for children? So those under 18 years of age.
Yes, so not at this time. A lot of times when new vaccines are being tried out that are for the adult population primarily, the initial tests are for the adults. And so as you see, the Pfizer has been tested and is available 16 years and older, and then the other two for 18 years and older. We do expect there are trials going on right now for the younger populations because younger children can get significant infections. Those infections are much lower rates than with adults. And so expect more soon, but right now we're just testing this at the older age groups.
That's good to know. So what type of identification do I need to show in order to receive the COVID-19 vaccine?
You should get specific instructions for what you need to bring when you sign up for the vaccine, and that is going to vary. There are some sites and some locations that may ask for a photo ID. You can bring your driver's license if you have one, but you can also bring your business ID, a photo ID from your workplace. That should suffice. So there can be many different ways of having the photo ID, and all of those should be, but I would also just read the instructions carefully so you can make sure you're bringing the right documentation.
So can the information that is collected at the vaccination site be used to deport or arrest individuals?
No, absolutely not. It's a totally separate process. This is not possible to do this.
Good. Thank you for clarifying that. So Dr. Perkison, will the vaccine be mandatory at some point?
Well, right now, these vaccines were released on an emergency basis. It was an emergency authorization, so things could move fast because this is a pandemic. And so because of that, it is not mandatory to get a vaccine. At some point in the future, it's possible at some workplaces or some institutions, but right now, no. No place is it mandatory.
Thank you. Will we be needing to get the COVID-19 vaccine every year like we do with the flu or the influenza vaccine?
It's possible. As you may be aware, this virus, there are different variations that are showing up. But at this time, there is no evidence that we will need to. So far, this is a brand new virus, and since we've had these vaccinations, there's no indication at this time that another vaccination is needed, and we will just have to wait to see how that goes before we would determine if a booster vaccine is needed.
Great. So we're going to move over to the last part, the part of possible side effects from vaccination. Question is, will I get sick with COVID-19 from the vaccine?
No, absolutely not. You cannot get the COVID-19 infection from this vaccine.
Thank you. Next question is, are the COVID-19 vaccines useful or effective? And why should I get vaccinated if I can just use my mask and social distance from others?
We, as I mentioned, our trials have shown that this is very, very effective against the COVID-19 virus, that these vaccines are much more effective than if you were simply wearing a mask or doing social distancing. And so it is very recommended that you go ahead and get the vaccine, and you can continue to wear the mask, but this will prevent you from getting a potentially severe infection from the COVID-19 virus.
Insightful, thank you. So what is the percentage of individuals that are getting fever or other side effects after getting the COVID-19 vaccine?
So right now, our studies have shown about 80% will present with some kind of minor discomfort in the first few days after the vaccine. And typically, people may get a low-grade fever, they'll feel tired, they may get a headache, they may have some muscle aches. But it's important to remember that these are just local side effects to the vaccine. They're not dangerous. There's no evidence that they'll lead on to more serious complications, and that they will all resolve within 48 hours. These are not symptoms of the COVID-19 virus. They are simply side effects of the vaccine that are temporary.
Good, that's promising. The next question to kind of follow up to that is, are there neurological side effects or deaths due to COVID-19 vaccines?
And the answer is no. So I mentioned we've now got information on 80 million vaccines in the United States, 280 worldwide. We have not seen neurological side effects. We have not seen deaths due to the vaccination.
Thank you. So can I continue to get or can I continue to transmit COVID-19 if I receive the vaccine?
The vaccine is going to prevent you from getting COVID-19. They are very effective on this. So far, our evidence is that you cannot transmit the virus with the COVID-19 virus after having gotten a vaccine. But we are still collecting data. This is a very new virus and a very new vaccine, and so we're still collecting data. And the further along we get, we'll be able to tell with more certainty. But so far, the results are very promising that no, you will not be able to transmit the virus.
Oh, that's good news. So as we move on, the next question is, do I need to wear a mask and avoid close contact with others if I am fully vaccinated? When can I stop using my mask?
So it's been pretty commonly used, the term herd immunity, and to describe how many people in a population need to be immunized before you prevent the spread. And you can think of it like a herd of cows, and one cow has an illness, and if every other cow is immunized, they can't spread through the herd. It's sort of blocked in. Well, the same effect is in humans. So we need to get 70% of our population immunized before we can prevent this virus from spreading through our communities. When we get to that level, then we can begin to relax. And that is following the advice of our public health officials about when we can stop social distancing. But for now, we're trying to get to that 70%, so we have to all act using our mask, preventing any kind of spread, preventing spreading to others, and treat it just like normal until we can reach that number.
Thank you for that detailed response. So for how long does the COVID-19 vaccine offer protection, or for how long is it effective?
So since the vaccine is less than a year old, so far we know that it does have good protection, and the evidence is that this is going to last for at least a year, like similar to the influenza virus, and it may actually be longer. But we'll have to follow this in studies and follow people, and we'll be able to tell you more in the future. And as more and more people get vaccinated, we'll be able to know more about this and be able to tell people more definitely.
That's good to know. So we've made it to the end. Do you have more questions? It's absolutely normal, and we encourage you to have questions. You can visit the Centers for Disease Control and Prevention or the CDC page by visiting this page here for more information on frequently asked questions about COVID-19 vaccination. I want to take the time to thank you, Dr. Perkison, for your time and sharing your amazing knowledge with us.
Thank you. It was a pleasure to be here.
And thank you to everyone and for your attention today. And we hope that you're able to receive your vaccination soon. So stay safe and healthy. And thank